everybody, it's Dr. Wen. So just want to teach you guys how to put in a splint. So I usually do this in the ER, but now it's in the clinics. It's going to be the same technique. So you're going to need a scissors, blanket, and then with the patient permissions, we're going to make sure that we measure. So we already actually measure already. So we're going to cut the amount of splinting material so that we can make sure that these need to be tied off, because if not, air get in and this whole thing is gonna get hard, and then you have to deal with throwing it away. So same thing with this. You want to fold it and make sure that it is where it's supposed to be. And this is what we're gonna do. And remember, whenever you're ready to get it wet, it's gonna get hard. And then you put this thing inside and make sure that you clipped it so that air won't get in. So otherwise, this thing got to air for a while, it's gonna get hard, and then you lose the whole thing. We had to throw this thing away in the past because they will leak air, and then the whole thing get hard, and then you just have to buy a new one. Okay, so it's all secure. Now, with this, you can take this out. And you make sure that it fits. So, look like it's gonna fit. That's one. And then the other one, this is for your back. And this is actually kind of a little hard, so you're gonna cut it off. So it'll be like this. So, and I have one of my medical assistant gonna help me with this. We're gonna throw these two away. And then these are cushions that we put on the patient so that it give her some comfort so that the splint won't scratch the skin. And you don't have to do it tight, you just roll it around and make sure that it covers everything. Now once you do this, you can come back down and just like so. Okay? So when you put the patient in position, make sure you put them at neutral. And the reason is because if the patient is going to have to walk sometime later, their foot is already kind of at neutral. If you put the foot all the way down, when they try to walk, they're going to have to walk tiptoe. And if you dorsal flex it, then they're going to walk on heel. So you want to put the foot at neutral. Okay? So that's how it's supposed to be. And then whenever you get ready to wet this thing, we're going to get it wet. And once you get it wet, you're supposed to get it dry, and then after that apply it right away. So this one, and then this, and get it wet as well, and it get dry very fast, and when it dry it get hard. So this is the reason for the blanket. So you dry it with the blanket. Okay? Alright, so there's that. Alright, So we'll put it right here. One, hold it. And this is 2. Okay, just like that. Okay, and then with Ace wrap, you just, so you don't, just wrap it around. And that's pretty much it. Okay. And it will get hard in a little bit, so you gotta make sure that these are just snug enough with the patient neutral. Okay? And that's one. And then you make sure that these actually bend like this so it won't cut the patient's skin. So the edges bend down, and then down here should be the edges bend down as well. And this you don't have to peel it, you just twist and it's break. Okay? And you feel warm yet? Yeah? The patient gonna start feeling warm, so when these things gonna get harder, and then when they dry, it then become a splint. So now is the time that you make sure that you adjust these and make sure that these are coming down as well, so that it won't. Or you can actually pull this out because these are sharp. So you can actually take a scissors and cut the thing inside. Can you cut it short a little bit?
Just put it inside.
Yeah, you can pull it out and cut it inside. So that you guys can see, I'm gonna video it and how to see to cut the inside. So you kind of open it up and just cut the stuff inside whilst you're waiting to be dry, so that and these things are very sharp, so that then you just kind of cover it so it won't cut the patient. Okay. And then now you're gonna make sure that it kind of stay where it's supposed to stay. And then, so if you can ask the patient, like, let's hold it like this, and so if she can hold it like this for a little bit until it's dry, then she'll be good. Okay? Okay, and that's the end. Thank you guys.